This speech is for my speech class, and my speech topic is on healthcare, a career in healthcare. Today is Monday, May 14th, 2012. In general, most of us have been to the doctor or needed medical attention at least once in our lives, right? However long the visit may have been, you may have taken into account or may have not have taken into account the title or what exactly it is the person that does who's taking care of you. So today what I want to focus on in general is the difference between having a career in medical assisting and the difference between having a career as a nurse. Now, as a medical assistant, sometimes it gets confused with a physician assistant. These are two different things. A physician assistant is able to tell exactly what is wrong with the patient and prescribe medications, as well as begin a treatment plan. A medical assistant does not have these privileges. A nurse, there's two types of nurses. There's an LPN and then there's an RN. An LPN nurse and an RN nurse, while they work hand in hand together, they have totally separate privileges on what they can and cannot do in regards to patient care. Now, the reason why I'm able to talk about this subject today is because I am a registered medical assistant with American Medical Technologists. So I've done my own research, as well as I'm working hands-on currently in the field of medical assisting. According to United States Department of Labor, there are 539,222 jobs right now where medical assistants are currently employed. With the pay rate is an average of about $14.50 an hour. And that's according to the United States Department of Labor. They have about a 1% raise. However, for nursing, the RN nurse in more particular, there's a 2,737,400 jobs that are active right now that are nurses, with a 27% raise in the job market. In other words, what I'm saying is that there's a 27% jobs available coming for the nursing. Now, upon first glance, it would seem obvious that the nursing career would be more to lean towards too, because it's such in demand. And the pay rate is about $22.50 an hour, $37,000 a year. So that is pretty significant as far as pay rate and job necessity growth going on between the medical assistants and the nursing. So today I'm going to spend a little more time looking at specific details between the medical assistant and nursing. Let's start by looking at the common duties of a medical assistant. Medical assistants, what they do is they're basically the face of the office. You have a medical assistant that can be the front office and a medical assistant that can be in the back office. Usually the medical assistants that are in the first office are the medical assistants who take the patient's name, they take the insurance, they verify the insurance, they scan the photo ID, they may even take payments and co-payments that the patients may need to contribute. They also are in charge of keeping the charts together. Nowadays, everybody's going to the EMR system, which is electronic medical records. So the MA that's in the front office can kind of share those duties with the medical's records by making sure the patient's profile is up to date. However, you have the medical assistant that runs in the back office. These are those who usually call back the patient. The patients that are waiting in the waiting room, the medical assistant that works in the back office will come out, call the patient, take them back. They will do their vitals. And what I mean by vitals is they will check their temperature. They will use a blood pressure monitor to check their blood pressure. And they will also look at them in their physical appearance to see what may be going on to help them chart what exactly is going on with that patient. They will also do weight and height if necessary during that visit. It is very important roles for the medical assistant to take as much documentation as they possibly can about that patient, because again, they are the first face of the office. They can turn that visit around. They can, if that patient's having a bad day, they can kind of see what exactly is going on before the patient may see a nurse or even the doctor. They can gather as much information as possible to prepare the doctor and or nurse for the patient coming in into the office. So that's important. With nurses, nurses are a little more hands-on and thorough, if I may say. Nurses are able to, they do just as much patient care as the medical assistant, but let's take a little bit more look into what nurses may do. We have a little bit of the responsibility of the medical assistant. So with that said, nurses can provide medications to the patient through IVs. I don't know if you have a family member or you know of anyone, or if you've seen on TV how sometimes there are people that are in the hospital or even in a clinical setting that may need IV and may need medications administered through the IV. Nurses are allowed to do these things. Nurses are also allowed to what's the word I'm looking for? They're allowed to make a treatment plan for the patient. Their job usually requires long 12-hour days, stressful situations, especially when you're in a hospital setting, and they're on their feet a lot. They also may need to be a little bit more aware as what the doctor may or may not need. They may need to set the room up for a procedure. They may need to assist the doctor in a procedure. Nurses are able to monitor as well as run medical equipment. They're in charge of patient education. They can perform diagnostic tests as well as analyze the results. They can also use the crash carts to revive a patient if necessary. The medical assistants usually work about an 8-hour day. So now I did not mention that about the medical assistant, but from what you've been told today, whether an MA or nurse, each has a profession at a shot of making someone's difference in their lives. Nurses are very much in demand as well as medical assistants, but nursing may not be the right fit because of the long hours, the very stressful situations, and as well as it can be a lot more easier to take that home to your own personal life with being a nurse, just because you may be exposed to more in healthcare field as far as things going wrong with patients and their care, and you may be able to be the patient from the start to finish if they got diagnosed with something that's a disease and that will run its course for the remainder of their life. So sometimes it's very hard for nurses to detach themselves to those type of situations so that it doesn't affect them outside of work hours. With this said, I've provided a little bit of information just to kind of coat the responsibilities of medical assisting versus a nurse. I have not went over everything. There's so much more to learn that you can learn about the differences in healthcare field, but with both of them weighing in balance, I would think it's safe to say with either career that is chosen, you have to choose what's best for your family, for your lifestyle, and for what you feel like you will be able to tolerate and or give back in a career in healthcare. I would like to say it's also safe to say that either way, if someone chose to work in healthcare field, they would be making a difference in someone's life. So with that said, I would like to end this speech on the note that no matter what career you choose in healthcare field, just know that either way it goes, you're going to be making a difference in someone's life. Thank you, and this is Ashley Ramos.